The trust that we have worked really hard to build over the past 15 years as a medical provider for the Black community means that when patients walk through the door or they call on the phone, they see or hear from people who they know or who look like them and represent their community. And they also get attention from our providers that feels like our providers are really listening to them and spending time with them and listening to their concerns, their questions, and their doubts, and understanding how to provide care in the bigger context of what it means to really trust your healthcare provider.
It's a full community place. You know, they take care of the whole body. You know, they help you with food, they help you financially. And then the best thing is we got Dr. Jill is such a great doctor, and she cares, and it shows with her patients and stuff like that.
So when COVID hit the Black community, it hit hard because we were so family oriented and hung out so much that one person who had tested positive for it ended up affecting all the others that they were around.
The relational aspect of the care we provide is unique to both the community we serve and also the way we do care. We had patients who were sick with COVID that Dr. Jill called every single day to check in. And that takes a lot of time, and relationships take a lot of time. But that maybe more than anything really makes the difference.
I mean, this is like my first time getting signed to a doctor that I actually like. That's my experience, and everyone is friendly, is very diverse, which is I like, because you don't want to go to a place that nobody understands you as a person, you know, and so I like the diversity.
I mean, I really feel comfortable when I have a provider that's a female. Previous provider was a male, so it was a little bit difficult to talk about certain things. And obviously I know they're doctors and that's what they're there for, but I don't know, I just want to be able to feel comfortable, you know, and be able to ask anything and say anything. And having a female provider and being here, like I said, has been awesome.
We are also uniquely positioned to respond to the needs folks have around finances and around food, and some of the things that we just hadn't provided support around directly in the past.
Some of the things that we were able to help our patients with is cash, hands-on, writing a direct check so they can do what they want with it. Food was a necessity, so we were able to provide food boxes doing some of our events. A big thing is computers and internet, because with COVID, everyone is at home, so we need to make sure that you have a working laptop and internet. So we were able to give laptops and internet cards so people could pay up their bill and have good internet service.
North by Northeast has helped me tremendously through the COVID. Miss Sharetta continuously, and still till this day, she forwarded us a lot of emails regarding any grant, any food supply, mask supplies, money, funding. She has forwarded them to me, and I forward them to the rest of the shop and anybody else in my community.
They help me for bill payment, some utility payment. I tell the list of the food items I need. They just delivered one day from Safeway. That it helped me to support my life, my expense.
Just being able to help, you know, the people in need. You know, I never would have thought that any clinic would help people in need, and just to give as much, you know, help that they can. Yeah, so it's been amazing. And I really thank them from the bottom of my heart, be able to help me in the most difficult times, especially, you could say, being a single mom to 2 kiddos. I just have no words, you know, anymore, just to say thank you. You guys are amazing. And thank you for all the help that you've done. I mean, they really changed my life, so I really appreciate that.
The needs that our patients have continued into 2021 and will continue through this year and likely into next year. So while we will keep doing all of the primary care and the community health outreach and education we've been doing for many years, we will also continue to do all of this new work that we started doing last year to support our patients during this pandemic.